Have you ever wondered how doctors can look inside your brain to understand how it is working? Neurologists use a variety of specialized tests to evaluate brain health. These tests range from comprehensive physical examinations and detailed cognitive assessments to advanced imaging and electrical studies. They are designed to help identify conditions affecting the brain, spinal cord, nerves, and muscles, providing a clear picture of your neurological function. The choice of test depends heavily on the specific symptoms you are experiencing and what your neurologist suspects might be the underlying issue. For instance, a neurological examination assesses your reflexes, balance, coordination, muscle strength, and sensation to check for any physical signs of nerve or brain damage. Cognitive tests, often involving simple questions and tasks, evaluate memory, attention, language skills, and problem solving. Imaging scans like a magnetic resonance imaging, or MRI, or a computed tomography, or CT, scan provide detailed pictures of the brain's structure, revealing abnormalities like tumors, strokes, or inflammation. An MRI is particularly good for soft tissues and detailed structures, while a CT scan is faster and excellent for bone and acute bleeding. Electrical studies, such as an electroencephalogram or EEG, measure brain wave activity to detect conditions like epilepsy, and nerve conduction studies or electromyography assess nerve and muscle function. Preparing for these tests often involves simple steps like bringing a list of your symptoms and medications to your appointment. For some tests, you might be asked to avoid caffeine or certain medications beforehand, or to wear comfortable clothing. During the tests themselves, you can expect your neurologist or a trained technician to guide you through each step, explaining what they are doing and why. Imaging scans usually involve lying still, and electrical studies might include placing small electrodes on your scalp or skin. These preparations help ensure the most accurate results. One important concept to understand is the idea of a baseline. Establishing a baseline of your brain health through these tests, especially if you have risk factors, can be incredibly valuable. It provides a point of comparison for future evaluations, allowing your neurologist to detect subtle changes over time that might indicate an emerging condition or the progression of an existing one. This proactive approach can lead to earlier interventions and better outcomes. Ultimately, these neurological tests are vital tools for understanding, monitoring, and protecting your brain health. They allow your neurologist to precisely diagnose conditions, tailor effective treatment plans, and help you maintain the best possible quality of life by addressing concerns related to your nervous system. By shedding light on the intricate workings of your brain, these evaluations empower both you and your healthcare team.